Good day, everyone. This is On Call with Doc Dave, and we're going to go to episode 5 today, which is going to be very interesting, I think, because it's so common for most people to have this disorder sometime in their life and sometimes even more frequent. So today we're going to talk about headaches. And headaches, range from mild to uncomfortable to debilitating. See, it's important to know if your headache is something to be concerned about or if it's somewhat routine in nature and can be treated by yourself, like most entities can be. But you need to know when it's important to seek medical advice. So, the first type of headaches we're going to talk about are common non-serious headaches. These are the most frequent ones. These are like 90% of the headaches. And usually it's bifrontal. It's not localized to one side or the other. Obviously, you don't have any motor deficits or speech impediment or anything associated with it. It's usually caused by, common causes are stress and tension. Dehydration is a big one. Sinus congestion, where your sinuses get blocked up and the pressure in your head goes up because it can't get dissipated by going through your nasal canals. Fatigue, anxiety is a big one. Hormone changes. Excessive physical activity, going to the gym, working out too hard, maybe, running too far, working out with weights, putting a lot of strain on your system. Certain medications, and noise and glare. These are the common causes of the majority of headaches. Now, more symptomatic and painful headaches are the next type of category that I want to discuss. And these are ones in men, ones in women, most commonly. There's cluster headaches in men, which kind of come in what the name describes as clusters of headaches. You get them in cycles of 2 or 3, and then they dissipate and go away. There's no other precipitating event that causes the headaches. There's not any of the above symptoms that I just got through mentioning, or any fever or trauma or motor deficit or neurologic symptoms. And these are generally treated by just rest and turn the lights off and take some Tylenol. Now, the ones that are more common and mostly in females are migraine headaches. Now, migraines, they come on, quite frequently if you're unfortunate to have that type of disorder. They're usually associated with nausea and vomiting, photosensitivity. When you look at the light or you're out in the sun, your eyes get real sensitive, and maybe even certain visual disturbances. So if you've got migraines, you know the pattern, you know what trips them off. You generally have medication that your doctor's given you that you can take for them, or sometimes they may just resolve by over-the-counter medications. So those are, that's the step up from your common headaches. But again, they're not anything that, generally serious that you need to, have attention from a physician on an urgent basis. Now, the ones that are serious, and these are headaches that if you get these, you need to deal with them. If you've had headaches before and you know how to deal with your common headaches, or if you get migraines or clusters, you know how to deal with them. But these are headaches that need urgent medical attention, either by your physician or go to an emergency room and get it looked at. It's usually what people, in my experience in the emergency room over 50 years, they come in and they say, "Doc, this is the worst headache in my life. I've had headaches all my life, and this is totally different." That's a real red flag. You got to respond urgently and thoroughly to that as a physician. That's what we call a neurologic medical emergency. Now, what are the things that can cause this? Usually it's 2, maybe 3 things. First thing is you may have, a meningitis, which is an infection of the brain. And this could be, most commonly, it's a viral meningitis, which is what we call an aseptic meningitis. Means if you do a lumbar puncture, you just get back nondescript cells that aren't seen with bacterial infections, lymphocytes, things like that. And there is no blood in the LP, which is important. The LP isn't cloudy. It doesn't grow out any bacteria or any signs of infection. And the pressures in the CSF are generally pretty normal. Now, the other one, which is more important, is a bacterial meningitis or a meningococcemia. You can see these in kids, they usually present with a petechial rash, which means you get these little blood blisters all over your skin, have a high fever, 103, 104. You may have a seizure associated with it, and you've got some altered level of consciousness. In other words, you're just confused, disoriented, and, just obviously totally different than your normal state of affairs. So those require urgent attention, especially if you got the fever. And you go to the doctor, you go to the emergency room, and they'll do a lumbar puncture just to look and see, if there's cloudy, if there's bacteria growing in it, if there's white blood cells in there, if the pressure's high. And, these are all signs that you've got some type of a bacterial meningitis, pending what the cultures show. And these will require isolation. They will require IV antibiotics, depending on what the culture and sensitivity of the lumbar puncture is. They will obviously require observation and treatment of any seizure activity that may be associated with it. And, control of your fever, get your fever down, cooling blankets, emetics if needed for nausea and vomiting, and antipyretics for your fever. So this is a medical emergency, neurologic emergency as well. Now, 2 other things. One, maybe you've had a trauma to your head. Maybe you fell a week ago, hit your head, didn't think much of it. You kind of saw some stars. Maybe you had a little minor concussion, got up, walked away from it after a day or 2, started feeling better. And then you get these bad headaches maybe 2 or 3 days later. This is very important to go see a doctor as well, because you could have what's called a subdural hematoma. And what that means is, especially if you're older, especially if you're on blood thinners, especially if you're an alcoholic, those are risk factors. You fall, you hit your head, you've got those histories, you go to the emergency room immediately, the doctor will examine you and do a CT scan of the head to make sure that you don't have any bleeding in the subdural space, which can compress your brain and cause all kinds of terrible things, including death. So that needs to be looked at immediately. Now, if you get your head trauma and you got these symptoms immediately, then you may have more than a subdural, you may have an arterial bleed. And you go right to surgery, they do burr holes, they drill holes in your head, they release the compression, they release the pressure in your head so that your brain doesn't push through and cause issues with all kinds of medical entities, including death, as I said earlier. So trauma with history of alcohol, history of blood thinners, older age, maybe over 70, go to the ER immediately. Now the last one, which is very dangerous and can come on at any age, usually after 30, and people have had parents, siblings, whatever, just pass away immediately from this without any prior history, no trauma, no fever, no infection, no history of headaches. You're just sitting there one day and all of a sudden, boom, you get the worst headache of your life. It's sharp. You're losing your vision. You maybe got a motor deficit. You might have a seizure. all kinds of things can be going on. That is a 911 to the ER and rule out what's called a subarachnoid hemorrhage or a aneurysm. And that can be detected very easily by a CT scan. And, generally put contrast in there. And if they see it, then you go right to the OR and they clip it. They just put like a staple in there, and that will prevent, any further issues with the aneurysm. Because if you don't treat these, the aneurysm is like a balloon, and it'll continue to blow up till it pops. And once it pops, it just bleeds uncontrollably, and you pass away from that. So that's really important, obviously the latter part of this episode is the important part, because those are the things that could be life-threatening or have long-term complications. Now, the last thing, maybe even throw this one in, if you have a stroke. Now, usually a stroke's going to be pretty obvious. You lose your ability to speak, your face droops down, you can't move one side or the other, and, you get a headache with it, but that's the least of your problems. So when you go to the ER, the reason you go is because they do the CT scan, and if you may have a bleed in the brain, not a subarachnoid and not an aneurysm, but an internal bleed in the brain, and that needs to be dealt with. And if they don't see a bleed, then they treat it relatively conservatively, keep your blood pressure under control, keep you under observation for a few days, repeat the CT scan in a couple of days, make sure it isn't changing, and eventually, if you survive this, you go to physical therapy. Maybe you get put on aspirin or blood thinners, and, you just go from there. So that's pretty much everything you need to really know about headaches. I hope this was informative. There wasn't anything too entertaining here, because this is pretty serious stuff sometimes. So we'll be more entertaining in the future episodes. So again, if you like this, hit the like button. Like I say, if you really like it, hit the subscribe button, blast that. Okay, and thank you for your time, and we'll be doing further episodes as I promised. And again, sign off. Remember, I'm your friend, not your doctor. So talk to you soon. Mm-hmm.